Hey y'all. So it seems like everyone's kind of struggling a little bit more, even more than what's become normal for us in recent months, recent years. And maybe it's a drop in the bucket, but I just thought that I would start to um, see if I could help at all just by, giving some ideas on kind of managing, you know. Um, the first thing that came to my mind when thought about doing this is something that I've already told some of the teams that I visited, but I figured it would be good for the rest of us too. Um, Really simple concept, not going to kind of blow your mind today or anything, but it's this very simple idea that if you are having a hard time, if you're in distress, struggling, however you want to label it, whether we're talking about overall in general or just in a given moment, um, there's a pretty good chance, if I were going to guess, if I were going to bet on it, I bet that you probably have a good reason for that. You probably all have good reasons to be struggling in any given moment. Um, I highly doubt you're being silly or weak or exaggerating. Um, that's pretty much it. You know, um, Simple idea, right? Not rocket science, and yet if you start to pay attention and watch yourself, you might find it interesting or surprising how often you're actually connected to that idea. Um, and instead, how often you are kind of rejecting your experience or trying to make it be different than it is. Um, Beating yourself up would be a really good example of this. We all do this, right? All day, every day. Do it to each other too, actually, even when we mean well, saying things like, you just got to move on, or God won't give you anything you can't handle, um, really, if you think about all these things, it kind of comes down to this idea of stop feeling how you're feeling, right? There's something wrong with it. You need to change it, you know? And that's actually a pretty big deal. When we do that to ourselves, when we do it to others, it's so basic and it's so ingrained that it kind of flies under the radar. Sometimes quite literally, it's completely self-conscious or subconscious, sorry. Um, but we do this in it and it kind of creates a foundation for all of the rest of our thinking and therefore our feeling, right? Like, so if the way I'm feeling and the thoughts going through my head are expected given my situation, then I shouldn't really be trying to do anything with that, right? I shouldn't be trying to change a natural normal experience, right? um and yet if it's something that's wrong with me, if I'm too anxious or overwhelmed or what have you, that's bad, right? That's a problem. That's something that needs to be fixed, you know. Um, and we pour tons of mental energy into that. Start watching, pay attention. We pour a ton of mental energy into trying to make ourselves think and feel differently than we feel, or again, beating ourselves up about what we're thinking or how we're feeling. Um, and by and large, that mental energy is wasted, because we're trying to do something that's impossible. We're trying to do something that isn't really doable, making ourselves just be okay when, our situation and our experience is just simply not consistent with that, you know. Then we get really frustrated because we're trying to do something that's impossible, thinking it is possible, thinking everybody else is somehow managing to do it, but we're not. And it just ripples out over and over. It's such a vicious cycle. Um, so my little thought today is just think about this. Try to watch for it. See if you can catch it happening. And if you do, try to do kind of a nice, gentle, you can rib yourself a little bit, kind of like a little bit of a mental chuckle or eye roll, I guess, is okay. But for the most part, just try to catch that and say, oh, wow, there's that thing going on that Dr. Bruner said we all do, and see if you can't just basically just let that be. Just notice it. Um, Try giving yourself a little grace, a little kindness, a little compassion. Try saying, oh, wow, actually, this makes a lot of sense that I'm struggling with this. This is really hard. It would be weird if I were just fine while this was happening to me. You know, um, just see how that goes. Think of it like an experiment. It may not make a difference, may make a big difference. I think that covers it. I'll try to come up with some more ideas that will probably kind of fit in with this since it's so foundational, but I'll see what else I can come up with. And if people like these, I'll do some more of them. So, okay. Have a good one all. Hang in there. See you around.
This is an informational video that is not intended to replace professional treatment for specific mental health problems or symptoms. If you're having thoughts about harming yourself or others, call your therapist or doctor right now. You can find contact information and call your nearest HSO location to schedule an appointment at www.healthsourceofohio.org/locations. You can also talk to someone now by calling the suicide hotline at 1-800-273-8255.